Today's session was looking at engaging and mobilizing communities in the fight against TB. The communities are sitting with the burden of TB, and it is up to them to basically respond to the TB program. So it is very important that they engage and that they're part of the fight against TB. One way of getting involved is if they have awareness, they understand the basic signs and symptoms of TB, and then they can be the one that encourage the rest of the communities to go and seek treatment. So I think that is one way. And also, if they are trained in terms of supporting TB patients, that is the other way that the community can then encourage people to finish the medication. Community needs to unlearn some of the things that they've learned in the past. What I mean by that is there is still this link between TB and HIV. So the stigma around, so people are scared to go and be screened for TB because people are going to think that they're HIV positive. So there's still that stigma around, but it's not always the case that when you have TB, it's automatic that you have HIV. So if we can destigmatize that and have new messaging around that, I think communities will be able to deal with that stigma. It was evident from the session that we had now that volunteers are key. I'm going to differ slightly. Coming from South Africa, some of the countries are poor. So volunteers can't even afford to volunteer. So we need to be able to come up with a system where people are paid. And one of the advocacy issues that we're fighting in South Africa is the fair payment of community care workers. One of the sessions was looking at door-to-door cases where that program was able to find TB cases. If it wasn't for those volunteers, we would not have found those people, and in turn they're infecting other community members. So it is important to have volunteers to work, but also I think government should think about how they can sustain that and basically give people fair pay and job for what they do.